My name is Cora Fry, and this is my example of a transfer of a patient from the family birthing unit to the NICU. I will be utilizing the ISBAR method. Okay. First off, I'm going to introduce myself. My name is Cora. I am the nurse on the family birthing unit. I am calling to give you a report on an infant who's being transferred to the NICU. Is this Nurse Casey? And are you expecting a transfer patient? Okay, good. I'm glad to hear that you know you're getting a patient. This is the situation. Due to our policy, this infant requires further intervention and NICU monitoring due to hypoglycemia. He has had two critically low readings. Otherwise, this infant is stable, and the family is at the bedside, and they are supportive of this decision to transfer the infant to the NICU for further care. So the background on this infant, this is a 4,200 gram male that was born at 42 weeks gestation. He is 26 hours old, and he was born vaginally following an uncomplicated pregnancy that he did have, the mom did have prenatal care throughout. She was ruptured for less than 4 hours. The infant transitioned well for the first 24 hours. He even passed his initial glucose checks. However, his last two glucose readings have been before meals and have been below 30. They have been 29 and 28. His mother suffered a postpartum hemorrhage that has decreased her immediate colostrum production. Despite education, the family has strongly resisted any supplementation up until this point. They are currently considering giving some donor milk, which the father's sister is planning on bringing in tomorrow afternoon. So we are currently waiting for that to arrive. My current assessment of this infant are that his vitals are stable. He continues to require 2 blankets, and we have made frequent trips over to the warming station to keep his temperature normal, but it is on the low side of normal. He also has intermittent tachypnea without nasal flaring and without any retractions. He latches well to the breast and wants to feed often. He remains asymptomatic of his hypoglycemia despite his low levels. He has had 2 urine diapers and 2 meconium diapers since birth. He's bonding well, and his mother and father are trading off in skin to skin with him for now. The infant has fed often, but again, the amount of colostrum he has received is questionable. I recommend that he become admitted to the NICU for IV correction of his hypoglycemia and stabilization. He should be weaned to donor milk when available, and we should continue to encourage parental bonding throughout his NICU stay. The pediatric hospitalist says they will continue to monitor the patient until his glucose is stable and he is able to transfer back out of the NICU onto our floor. And then, do you have any questions about this 26-hour-old infant who is being admitted under the hospitalist group for hypoglycemia? Okay. His parents will be arriving after you get him settled. Does that sound okay? And could you tell me which room we are going to? All right, thank you. See you soon. And that is my example of a transfer from the family birthing unit to the NICU using the ISBAR method.